Hi, this is Dr. Nina Naidu. I'm a board-certified plastic surgeon in New York City, and as part of a series about breast augmentation, I wanted to talk about the individual implants. So today I thought we'd talk about saline implants. This is a saline implant. This is a sample from Allergan, which has a brand called Natrel, and this implant is not yet filled. Obviously, it's empty. The shell, which most people don't realize, is actually made of silicone. It's a firm, durable silicone, very sturdy, and the inside is what's filled with saline once it's put into the body. So this is how it arrives when we're in the operating room. We take it out of the package, sterilely of course, and we use a small incision. We basically fold it up kind of like a little tortilla, put it into the body, basically put it into the patient, and then through that little incision we can unwrap it, and then saline is introduced through a small port right here, and the implant is filled with saline. Saline is put into the syringe, of course, and then it's filled through this port. And then when the fill is done, you just remove this, and there's a secure closure. So that is how the implant is filled. And when it's filled up, this is what it looks like in the body. So this is an example of a saline implant. This is filled, and it's filled almost to full capacity. You can see I've left a little bit of room in there just to show you what the full capacity is. And there are some advantages and disadvantages to saline, as with anything else. So the advantage is that, as we noticed, you can use a small incision since we're folding it up to put it in the body. The other advantage is that because it's a simpler manufacturing process, saline is a bit cheaper. So if you go to a surgeon's office and get a consult and ask for saline versus silicone, if you notice the price breakdown, silicone implants are more expensive. So that is another benefit of saline. A third benefit is that if the implant ruptures for any reason, the saline leaks out and it's absorbed by your body. So that's nice in terms of just monitoring your implant. You can tell by looking in the mirror if your implant has ruptured or not. The downside is that if you have a rupture, you'll notice a sudden change in the size of your breast. So there's a benefit and a downside to that. Some of the things that people don't like about saline implants are that, as you see, it does tend to ripple. It does tend to get these little curves whenever it's sitting upright. And remember, most of the time our bodies are upright, and so it can show these little wrinkles and these little curves, which a lot of people don't like. The other thing is that if you feel the implant, it really does feel a bit like a water balloon. It doesn't feel as smooth and natural as a silicone implant. If you have a lot of soft tissue, meaning if you have a lot of your own breast tissue, then you may not notice the difference. In thin women, though, they do tend to feel that kind of balloon feeling to the breast, and it gives a slightly more firm feeling than a silicone implant would give. So that's another disadvantage of saline. However, that's really it. All the implants that they have today are very good. They're very safe. They're all excellent choices. But I just wanted to show you a little bit about saline implants and what they actually look like.